believe in the ripple effect.
What's up? Another episode of Ripple Effect Podcast. I'm your host, Ricardo Vrenz, also known as Ricky Vrenz, and a great episode for you today. Today we have Brook Jackson, also known as the Pfizer whistleblower. I have such respect for whistleblowers like herself who are willing to put their careers on the line and sometimes even their lives on the line to get the truth out. And in the past, I've had Thomas Drake on the show, who's the NSA whistleblower. I've had Michael Suzanne, who was a part of the Oil for Food UN scandal, and there's a great movie called Backstabbing for Beginners all about what happened to him and that whole scandal. I highly recommend you guys checking that out. But today we're going to learn about what Brook saw when she participated in the Pfizer vaccine trials, and she was also a recent guest on the Union of the Unwanted. I invited her on there to help spread her story and share the story with another audience. So I highly recommend you guys checking out the most recent Union of the Unwanted. This conversation was actually recorded before the Union of the Unwanted episode. I wanted to release this episode before I invited her on the Union of the Unwanted, but with Sam Tripoli recently being on the Rogan podcast and him being one of the hosts of the Union of the Unwanted, I wanted to make sure the next episode of the Union of the Unwanted was a big one, just in case we got a little bit of a bump with Sam Tripoli being on JRE. But either way, it also helps spread this information and spread her story and connect her with other people. So it was a fun discussion. Listen to this episode. Please also listen to her appearance on my other show, The Union of the Unwanted, which, like I said, I host with Sam Tripoli, Midnight Mike from the OBDM show, and Charlie Robinson from the Macroaggressions podcast. But before the intro gets too long, let me mention this is a value for value show. If you get some value out of this podcast, if you get some value out of this conversation or any of the conversations I bring to you, please consider giving some value back. There's a lot of people out there who aren't in good financial situations that reach out and tell me they wish they could financially support the show. Don't worry about it. Don't feel guilty about it. There's ways you can support the show by watching my videos on Rockfin. That helps. Just by watching my free videos on Rockfin, you can contribute to supporting the Ripple Effect podcast. You can write a review. You can tell people about the show. You can share it on all the social media platforms you're on. But if you can financially support the show, if you're in a good financial situation, don't be a cheap ass and contribute something. It doesn't have to be much. You can donate as little as $1 a month on Patreon, and that gives you the opportunity to participate in our Patreon podcast. And I have so many amazing listeners out there that are constantly sending me interesting content and information and articles. If you guys are out there and you want to participate in a conversation, if you want to come on a episode of the Ripple Effect podcast and share some of your knowledge and research, please consider joining my Patreon. Donate as little as $1 a month, like I said, and then once a month, I put together a Patreon podcast, and you can participate in that. You can share whatever perspective, opinion, or research you might be doing and have a great conversation with myself and other people in the community. We also have a merch store where you can get t-shirts, hats, mugs, hoodies, and stuff for adults and kids and females, a little bit of everything. So please check out the rippleeffectpodcast.com. You can find all these links there. Or if you want to go directly to the merch store, go to the Ripple Effect Podcast merch.com, and that will take you directly to the merch store where you can get some gear to represent one of your favorite podcasts and help support the show. Other ways of supporting the show is we have a crypto wallet, and on my website, rippleeffectpodcast.com, you can find the addresses if you want to send Bitcoin or Ethereum. On my website, I also have a link to my music. It's called Theory 6. That's my solo project. It's the music you hear during the podcast, at the end of the podcast. And if you like some of it, please consider purchasing some Theory 6 music. It's available everywhere you can get music: Spotify, iTunes, Amazon, Pandora. It's available everywhere, but the link on my website will take you to iTunes. But like I said, you can find it just about anywhere. Lastly, I have a couple sponsors, and of course, if you've been listening to the show for a long time, you know I'm not a big fan of sponsors. But if I have these sponsors, it's because I believe in the products, I believe in what they're doing, and I think you can actually get something out of it. And one of the sponsors is Content Safe. And what Content Safe does for me, they save me tons of uploading time by spreading my videos to all the video platforms. I upload to one platform, and then within a day or two, it's available on all the other video platforms. So basically, it syncs my one channel to all my channels, and it saves me tons of time. I don't have to upload all the show description, thumbnails, all that stuff. I just upload to one place, and then it syncs to all my other channels, which is really a genius idea and a must-have if you're a podcaster, YouTuber, or content creator. And Matt Raymer, the CEO and creator of Content Safe, is a regular on the Ripple Effect podcast and a regular on the Union Unwanted. So like I said, I don't like sponsors, and that's why all the sponsors I do have are people that I'm friends with, people that have been on the show, people that I've been following their work for a long time and really respect them. Just like my next sponsor, the University of Reason, and the very popular autonomy courses created by Richard Grove, another person who's a regular on both my shows. If you're at a crossroads in life, if you're looking to expand on some skills or learn some new skills, please consider checking out the University of Reason. Last sponsor is Element Electrolytes, which was created by Rob Wolf, somebody who is very respected in the health and nutrition world. Rob Wolf has also been on my podcast and many other podcasts, and he created Element Electrolytes, which I was already using before they became a sponsor, and I'm super excited to share this product with you guys. Many people out there have daily symptoms that are due to dehydration, and Element Electrolytes can help with that. If you have muscle fatigue, if you have headaches, if you're just having a hard time staying hydrated, which of course can have a negative effect on you physically and mentally, check out Element Electrolytes. Unlike many of the real popular electrolyte mixes or electrolyte drinks that you see on the market, this one doesn't have any sugar or cheap sweeteners like sucralose. It's made with only premium ingredients. They taste awesome. They're good for you. They help you stay hydrated. And if you use the link in the show description or the link on my website, you get a free gift with every purchase. The two last things are I have a Telegram group chat for Ripple Effect Podcast listeners. You can find that on my website, rippleeffectpodcast.com. It's a place where listeners and myself can communicate, connect, share stuff. So definitely check that out. And also the Ripple Effect Podcast is now available on Substack. So please check out the links in the show description to subscribe to the Ripple Effect Podcast on Substack. That's it, guys. Enjoy this conversation, and I'll see you guys in the next one. Peace. Awesome. Thanks for being with me.
Sure. Thanks for inviting me.
Well, I think you have an important story to share with the audience, so I'm glad I can be a part of sharing it with everybody.
Yes. Cool shirt. You should send me one of those.
Yeah, I can. I'll send you one. Your address. It's funny because it's much harder to find a artist than you think, and the artist that designed this, I had kind of like a concept idea that I was kind of pondering on, and somebody hooked me up with a great artist, but he was like borderline crazy a little bit. He was so awesome. Like I'm like, this is kind of what I'm thinking, like, just play around with it, but I'm open to different ideas. And I know as like content creators, and I used to draw and I did music and stuff. So anytime you're being creative, it's like a lot of times you don't want too much direction. You want a wiggle room to kind of explore your imagination. So I gave him like, hey, how about like something like an Incredible Hulk type of design, but him smashing, kind of creating ripples. And he's like, okay, I'll send you some ideas. Within like a day or two, he sent me 3 or 4 different versions of it that I loved. And I'm like, wow, this is awesome. And then I'm like, oh, I'm into metal. So I'm like, a lot of the new metal or metalcore bands have like bright colors and all this stuff. And he's like, oh yeah, no problem. So and then he used like pink and blue and all it was cool. And I'm like, this is awesome. And then I wanted him to do another design for me. Couldn't get a hold of him for like, I don't know, months. And I'm like, what is this guy? And then something happened that he like his laptop broke and he was living out of his car, and
Oh,
he was like, it was. I'm like, dude, I will pay you to start the next design. I'm like, whenever, hopefully I'll help you get going. And I think I sent him some money to get going. Never heard from him again.
oh, shoot.
Yeah, which is, I mean, I don't know. It sounded like he had bigger problems than my design.
Right. Yeah.
I didn't want to bother him too much, but he was. I'm like, dude, if this guy could just get his shit together, I'm like, he was just so like I was stunned by how quickly he gave me like all the design ideas I liked. Like there wasn't one that I didn't like. I'm like, wow, that's I'm like, that's
Yeah.
awesome.
Yeah. That's cool how they can take, just kind of your idea and then pop something out super quick.
Yeah, no, I was like, the turnaround was absolutely. I was amazed, and they were all cool designs, and how quickly he could take just like a short conversation and make it real was pretty wild. But I mean, I guess all the best artists are a little crazy, anyways. Like they're probably the best musicians, the best everything. When you look at just art, actors, directors, filmmakers, whatever it may be, there's something about being a little off that kind of gives you the ability to see things from different perspectives or explore different ideas that maybe the average person wouldn't. So but this one,
yeah, I don't know why, but this brings me to do you know who Jessica Rose is?
oh, she's a good friend. She's on all the time. Yeah.
She's amazing, right? And she's a musician, artist, just such a talented woman. And I don't know, this conversation just kind of reminded me of her because she's so artistic and she's able to in my mind, like she thinks outside of the box, right? And yeah, cool.
Yeah, it's funny because my show was one of the first shows that she was interviewed on, and I couldn't find anything on her. And it was actually, do you know who Dr. James Lyons Wheeler is?
Mhm.
I
love him. Yes.
Yeah, Dr. Jack. He's awesome. He suggested him or her and Dr. Henry Ely on my
Yes.
show. So Dr. Jack and I kind of became friends from doing shows together. And then he's like, hey, you should interview these people. And I'm like,
Yes.
I'm like, if you're suggesting them, why not? And when Dr. Jessica Rose came on, I'm like, I don't know. I just got busy and I never got around to doing research on her. And then I was like panicking. It was like a first date or a blind date. You're like, oh my God, am I going to rift with this person? I find her any interviews she's done. Because at least if I found a interview, like I'm like, okay, I kind of get a feeling for like, how what she likes to talk about, who she is as a person, but I couldn't find anything. And then I'm like panicking. And just like you said, like 5 minutes into the conversation, I'm like, oh, this is going to be easy. And we did like, I think, I don't know, like 2 or 3 hours, and we barely talked about what we thought we were going to talk about. We talked about music. And like you said, she's a musician. She's a professional surfer.
Yes, that too. Yes. Yes.
And I tell her all the time, like, because she's been on a bunch. She actually just recently on with Dr. Stephanie Seneff. I don't know, from the MIT.
Yes. Yeah.
Yeah, and I've had her on with Dr. Cowens, Tom Cowan, and so I like having her, and I had her on with Dr. Pierre Corey, and she's awesome because she adds to the conversation. She can talk about serious topics, but it's never that serious because when you're with her, she always ends up, joking around or kind of keeps it very casual sounding, which is awesome. And
well, I think that the listeners and the viewers relate to that. I did anyways. I'm not a scientist. And when she talks, she's just able to, in my mind, like breaks it down in a way that is easily understood by the layperson, because I would certainly consider myself that. My expertise in clinical research at really the base level, the site level where the patients are enrolled into clinical trials. So I bring a unique perspective to this COVID-19 story that no one else is talking about. and like you said, it's important. And really, I have one of my good friends says that, Brooke, you were the lead steer in all of this. When I came forward in September, it was in 2020. So before the authorizations were even rolled out. So yeah, it's been a crazy ride so far, but I do love all those people you mentioned. Jack, I met him I think we were in DC. No, I'm sorry, we were in Ohio at an event, and I met him there. I haven't had an opportunity yet to meet Jessica, but hopefully, one day she'll be able to come over and do that. But we work together on some projects, and that's really, I think, at the end of this, when this is over for me, and I don't know when that's going to be, but friendships that I've made through all this are really important, and I've made some damn good ones.
Yeah,
with some fine people, that's for sure.
well, I think that, one thing that I keep reflecting on and I keep going back to is because right now it's like really easy to just say, hey, the vaccine like doesn't stop the spread, doesn't stop you from getting, oh, the vaccine, there's some injuries. Like it's really easy to have that conversation now compared to what it was like when you first came out and when people, like Dr. Jessica Rose, Dr. Jack, all the, Del Bigtree, everybody who's been just nonstop, just going against the grain and not being afraid of the pushback. Like hats off to all these people, yourself and so many others, because I think we tend to forget that in 2020, even hinting at the fact that you're skeptical about the vaccine or hinting at the fact that this could be a grand conspiracy or something along those lines immediately caused friction between friends, family, just everybody. And it was one of those topics that like people barely talked about in the open if you're going against the mainstream narrative, because you knew it would lead to a argument or conflict. And there's plenty of people who've lost friends. You made some friends. I think many of us made friends throughout this whole process, but many people also lost friends.
Sure.
But the friends that we made are probably better than the ones that we lost. So I'm glad. And to me, like the courage that it took to be out, like myself, for example, I have a full-time job. This is, my passion project. Hopefully one day it'll be my full-time job, but that's the goal. But for now it's a passion project. And I didn't have a lot of blowback because I was kind of just reporting on what I was finding and having people on that were experts, but I wasn't an expert. But people like yourself that were, you're getting criticized, having pushback because you're a whistleblower. And maybe we should get right into that actually, because before we get to the end or further into the story, let's get right to the beginning of the story. You have been interviewed on shows like, I know, Rebunked with Scott, and who's a friend of mine, and Lab with Ryan, who's awesome. He's another friend of mine. But for people who maybe missed those episodes, maybe haven't heard your origin story, do you mind going right to the beginning, maybe, and go as far back as you would like? I think a lot of times it's fun to kind of hear about the upbringing, maybe where you grew up, what town, what city, any of that stuff that helped kind of mold who you are today. Because I think to have the courage to be outspoken like you are and put your career on the line and your reputation on the line, I think there's probably a lot of things that happen in your life that that led you down this path that kind of make you who you are. So yeah, let us know where did you grow up, how did you get in this field of work, and anything else that you think might be relevant or interesting.
Sure. Well, I grew up in the Dallas-Fort Worth area. I've been here for most of my life. I was born in New Mexico, but been here so long, I call, I say this is where I'm from. I got into clinical research. I was actually interested in being a pharmacist. So while I was in school, I ended up marrying my high school sweetheart and talked about, starting a family and what that looked like. And really, I kind of lost my focus in school. And so, but I was still doing it. And I guess I can't even remember what year this was. It must have been, I was 18, so whatever, 98, I guess. My cousin, who was already in the clinical research industry, asked me to be a clinical research participant because I had really bad heartburn. And she was doing a study on a proton pump inhibitor that's now, I think, Nexium or something. And said, hey, I know you need the cash. If you come do this study, we can look at potentially, your just side effects from your heartburn, what that's doing to your esophagus, and put you on a medication, and you'll get $1,500 for participating in this potentially just one overnight stay. And so I did that. I became a patient. I saw what was, the informed consent and met the investigators and just followed the process and procedures in this protocol and did my thing, got my $1,500. And while I was in the study, the principal investigator and main study doctor that's over the trial, him and I just really hit it off. And my cousin was interested, the one that invited me to be in the study, was looking to move into another area of research. So I was offered, once she found another job and decided to take that, because of the relationship that I kind of just immediately developed with that principal investigator. He invited me offered me the job to be his study coordinator. And I did that for, it was nearly 10 years that I worked in gastroenterology, infectious disease, hepatology, worked a lot in the Hep C drugs, transplant and kidney transplant, liver transplant. And so that was really my start in clinical research. The principal investigator, the doctor I worked for at our teaching hospital here in Texas, really just took me under his wing, and showed me the in and outs. We had, I got a lot of experience in investigator-initiated clinical trials, which are different than pharmaceutical-sponsored trials, but we did both. We used a local ethics committee where, in the big pharma-sponsored trials, we usually use like a central institutional review board or ethics committee. I just got, I got a lot of experience there in doing that. And once I was ready to move on, just to something different and get into more leadership roles, I took a position at a hospital here in Dallas. It's Methodist, and worked on just a lot of different clinical research studies and different indications, cardiovascular, just so many, dermatology, really got some good exposure there, and was there for about 4 years or so, and then moved into a position where that was very similar to the company that kind of drags me into this COVID story, as a director of operations for that company. And I did that again for about 5 years, and just with the travel, I was ready to move on to something else and started working for Ventavia Research Group, which leads us to where we are now.
Yeah, that's interesting that you actually started as participating in a.
I did.
And so you've kind of seen it from both perspectives, from participating and also being a part of, the research. And so that's fascinating, which I think it probably gives you the unique perspective to kind of, I guess, pinpoint when things don't look right, or when corners are being cut, or something's not right. Well, so with your background,
I mean, that was so long ago. I mean, probably not. And it's really hot in here, so I'm going to take off my jacket if that's okay. It's Friday. I get to do what I want. But no, probably not, because at that point, I wouldn't have realized what would have been, what's normal, what's not normal, and being a new participant in clinical trials. But what did give me that experience was, what was built over that 20 years almost, where I saw what's normal, and then what happened to me in September of 2020, which was not normal.
So when the COVID thing started ramping up, what were your initial feelings? Were you skeptical about how dangerous this was? What were you? I mean, being obviously you have a lot of friends in health and medicine and working in hospitals and stuff. We're getting feedback from people to kind of get a feel on like what was really going on.
When I was a director of operations for the company that I was with prior to Ventavia, we worked a lot on the initial point of care tests or the rapid tests for COVID. So I was traveling so much anywhere or anytime there was a, I don't know if you remember them calling them hotspots. Whenever there was in the United States, whenever there was an outbreak, New Orleans, for example, I was there for 13 days straight, working on setting up an urgent care center to conduct this clinical trial, testing the rapid tests. So, being patient facing and enrolling sick patients into clinical trials, I was fearful. I totally fell for the narrative, which was this virus has the potential to kill everyone. I have never been a political person. I don't watch TV. I don't social media. I mean, I've been so focused on my career and my children. And so we just don't pay attention to really, much, that the media focused on, right? Except when we did turn on the TV, it didn't matter what, station we turned it to. It was death and despair. And we have got to shut everything down. And, I fell for it 100%. And at that point, I completely trusted my government, one, and my industry. And I'm not so naive that I do not think that there's corruption and misconduct in research and, within our regulatory, oversight people. I know it happens, but I guess maybe because I had my hand in it and I knew at my level that data integrity was most important. And I always ensured that happened. Do we make mistakes? Sure. I've made them. But there's a process and a procedure and follow-up and laws that are in place to report that kind of misconduct or, error. So yeah, it's been hard for me because I fell for it. I believed that if I didn't get the vaccine, that there was a potential that, I would spread it. I would get it and spread it. We were told if we did, that wouldn't happen. So yeah, I mean, I fell for everything. And it's very difficult for me to admit that. Because I've been told, Brooke, you should have known, you should have seen this. I've never seen anything like this before. As far as the clinical trial conduct goes, I was blinded by, not blinded, but shocked by that too.
Well, I think that's a common story. I think the reason why so many people did fall for it was because there's a lot of people out there who are just trying to be a good parent, be good at whatever job they're doing, just taking care of their kids and their family and their priorities, and they're not really digging deep into like all the corruption, big pharma or government and all this stuff. They just want to be left alone. They just want to live their lives. And then when this happened, yeah, I mean, you kind of grow up believing that vaccines are always helpful and that, if you don't take them, then it could be harmful and your government's looking after you and big pharma's about, protecting people and saving lives and getting people safe and effective medicine. And so it's not uncommon. I mean, when I had Dr. Robert Malone on my show, I remember when I was still on YouTube at the time, when we were talking and he's like, people call me right wing because right wing shows are the only ones that will talk to me. He's like, I'm not political. I don't care if you're right wing, left. He's like, I'll go on any show. And similar story where he's just been really deep into the research and the science. He hasn't spent any time focusing on politics or whatever. So it's sometimes you can be blindsided because of that. That's people like myself, I've been big pharma, and those type of issues have been a focus of mine for a long time. I've had Dr. Brzezinski on a long time ago. He was one of my first guests in like 2013 or 2014. Dr. Gregory A. Smith, who did the documentary American Addict and American Addict 2. So like these, it's always health and nutrition and exercise have always been topics that I'm intrigued with. So when I started uncovering all the like poor science, all the profits being made, all the natural remedies and other perspectives on medicine that have been suppressed, I'm just like, wow, this is like one of the biggest issues of our time.
And I still, I still wish, and it still needs to be talked about how important nutrition, our diet, that, those topics are to, especially COVID, because, these comorbidities are causing issues in people.
Yeah, a majority of them are if even if you believe all the numbers and all that stuff, and obviously all that data can be manipulated and has been, I've had Dr. Scott Jensen on, who I believe he audited some deaths in his state and found a bunch of car accidents that were called COVID deaths, a bunch of crazy stuff. And now it's happening everywhere because people are just testing positive, and yet they were in the hospital for other reasons. So, so the numbers were easily manipulated. But
sure they were.
Yeah. But the thing is, so many people that in 2020 and 2021, if you were afraid of dying by this disease, then, we know for a fact, even if you believe the numbers or don't believe the numbers, we know for a fact that just about a huge percentage of people who are actually being negatively affected by the virus are obese. They're people who are out of shape, fat, don't take care of whatever it may be. And it's like, so you've had 2 years or at least a year to get yourself from like high risk to low risk just by losing weight and watching your diet and exercise. But we live in a world where everybody wants the easy fix. It's like, okay, that diet pill work, let me look into that diet pill, because that's way easier than having the discipline to eat right and exercise. So we're constantly looking for these shortcuts, and the vaccine was kind of the same thing. It's like we knew that exercise, dieting, getting vitamin D, all these things were going to be helpful. But it's like everybody's like, well, it's way easier just to get vaccinated. And according to what the TV's telling me, I get my life back if I get vaccinated. Like, we get to open things up. I don't have to wear a mask, even though all these people who were repeating this stuff never logically looked at what was going on. I remember initially when they were first proposing the idea, if you get vaccinated, you don't have to wear a mask. I'm like, how does this make any sense? I'm like, the vaccine doesn't stop you from getting it or spreading it. The mask, if you believe it works, it's for the purpose of preventing you from spreading it. So why would you get the privilege of not wearing a mask if you get vaccinated? But it was just like, they would give you any incentive. I remember when like all the ridiculous incentives, like, you get a lottery ticket if you get vaccinated, you get less time in prison if you get like, I'm like, oh my God, they are states with it.
I've never heard that.
Yeah, they were in Massachusetts. I believe in Massachusetts, where I live, was one of the states where they were getting less sentencing if you get vaccinated. Like, they would give you less time in jail. Like, it was like they were finding every possibility. There was also that story that was going around about like free donuts, which was hilarious, because I'm like, oh, so you're getting vaccinated to protect your health, but then you're getting donuts.
You get a donut. Yeah.
How does this make any sense? The whole world just felt like insane. That's why shows like this one and all the other ones, we got so much feedback from listeners saying, like, thank you for keeping me sane, because I felt like everybody around me was absolutely crazy. And then when everybody was kind of agreeing on what was going on, and I'm like, no, none of this makes sense, I thought I was going crazy, because I was like the only one who could see through the BS. So it's but back to your story. So so you did, again, like, you had no reason to believe that anything was being manipulated or there was any real corruption, because you just been focused on doing your work, like you said, raising your kids, being a good parent. And so the time comes and you start, so how did you get involved with Pfizer? Because you weren't directly working with Pfizer, right? You were working for...
Right. So Pfizer delegated some of their clinical trial responsibilities to outside, or to, contractors. And so one of those contractors was Icon. So Icon was tasked to select some of the clinical trial sites. And one of those sites that were selected was Ventavia Research Group. So in September, it was actually August, I was offered the position as a regional director for 2 of the 3 clinical trial sites that were participating in Pfizer's COVID vaccine trial.
So you were a part of these, okay, doing this this study. Now, at that time, like, did you know the purpose was to try to get these vaccines approved as quickly as possible? Did you know, did you feel like this was like really important work because obviously we need to get this vaccine to the public? How was, you know, did you have that feeling like, oh, this is really—
Sure. Yes, absolutely. That's a great question. You know, I went again from testing these rapid tests in my previous job, and you know, just working so much and traveling so frequently, I needed something close. So to finding Ventavia, where they were, you know, participating in this, you know, pivotal, what the FDA and Pfizer describe as a landmark study. So I went in excited to bring my experience. I was excited to work on this trial. I've been involved in biologic studies before, fast enrolling studies before, high enrolling studies before. So this was right up, you know, in line with my experience and what I could bring to just the conduct of the study. I had ideas, you know, to improve what I was told was kind of their current process. And then I started on the 8th of September of 2020 and walked into a nightmare that I haven't woken up from yet. I started noticing things right away. You know, the size of the clinic was the first thing, you know, really that, you know, just walking in, you get a sense for, you know, the company, right? And it was small, but there were plans to move to a different space within the same building, just different space. And so that was, you know, that was good. And, you know, as that first week, you know, I think back on it, and I feel like it was just yesterday, but I mean, but then I look at the date, right? And I hear us talk about 2020, September of 2020. It's so long ago. And I guess, you know, the patient safety really is just the first thing that when I start to tell the story, that still worries me. You know, I'm worried about the patients that enrolled in this trial, you know, almost 2 years ago now, and those that are getting their shots today. I worry about those people based on what I saw.
Yeah, so it was uncommon to see such a small, I guess, office or facility for such a big project. Is that what kind of caught your eye at first? You're like,
yeah, because I mean, the number of patients that Ventavia was looking to enroll overall, but then broken down on a weekly basis, you know, and being able to safely monitor those patients in such a small space was impossible. It could not be done. We had 5 exam rooms. We had sometimes, you know, 4 to 5 coordinators, and one principal investigator who was in my 18 days, I saw literally 2 times. This is the doctor that's, you know, monitoring patients' journey through start to finish. He was never there. There was not a registered nurse on staff. There was not even a licensed vocational nurse on staff. These were inexperienced people that were monitoring these patients. You know, how they were able to kind of get away with that is by having a sub-investigator on the study who was located in the building, but on a completely different floor. So that was their idea of having somebody at the site who would be able to help somebody if there was an emergency.
so could you get into what exactly were they doing for the study? Were they just giving people some people the vaccine, some a placebo, or were they kind of what was exactly the process?
So the design of this trial was a randomization on a 1-to-1 ratio. So every patient that was qualified and enrolled into the study that was randomized and vaccinated, one would get the actual vaccine, and the next person would get just a placebo or a saline injection. There was one person at each of the sites who was tasked with preparing the vaccine and injecting the vaccine. And that was the only person at the site that should have known what the patient got, including the patient. And that just keeps, a bias from being injected into the study, which is so important, because when you're doing a blinded randomized trial, so patients aren't treated differently. They don't know what they're getting, so they're not more likely to report symptoms or less likely to report symptoms. It's just kind of an unknown, and you go about your daily life. And if there is a problem, if you are experiencing a symptom, you contact the site and let them know. Ventavia did not respect or maintain the blind of these patients. So every patient that was enrolled was unblinded by them placing a document in their chart that showed that they were assigned to either the placebo or the vaccine. So that was one of my findings. That's critical, and really what pisses me off is because I have been, dismissed in a lot of ways, because what I did find at Ventavia was more sloppy than anything else related to safety and efficacy. I found more of that than I did the other. But the safety and the efficacy is number one, right? And although we only enrolled 1,000 patients of that 44,000 total patients, the 1,000 at Ventavia had the ability to change the overall safety and the overall efficacy of the entire trial, where they found that, this vaccine was 95% effective. My data could have changed that to 0. Negative efficacy. Could have. And that's why I asked the FDA to go in and at least inspect what I saw. And I made that call and made that report on the 25th of September after being there a couple of weeks, 18 days total, and got sacked the same day.
So yeah, that's crucial, because obviously knowing what you received, like you said, it can absolutely change the way you react to sometimes obviously, if you don't know if you got the vaccine or didn't get the vaccine, you might be more or less likely to document a symptom or whatever, so yeah, that's
sure. Or even how about how the doctor decides to treat you? If the doctor over the study that's seeing you looks in your chart and says, oh, this patient got the vaccine, and I believe that this vaccine works and it's safe and it's effective, so his symptoms that he's reporting or she's reporting are likely not COVID symptoms. Maybe they just have another virus that's,
or
GI, or pick your virus. But I know that this vaccine's working. I know that the patient got it, so it's not likely COVID. So I'm not even going to test that patient for COVID. That's the potential, from the doctor's standpoint, knowing what the patient received, and how that could affect everything. So it's huge. It's huge.
Yeah, and you see that even now, people who truly have faith in vaccines, and I say faith because it really has become like a religious thing, and that if they have any health issues, they completely dismiss it as like not vaccine related. And of course, doctors and if they have the same type of faith in vaccines, the same type of dogma, they could have the same reaction where they immediately will exhaust all other options before coming around and maybe coming to the conclusion that it could be vaccine related.
I know, but these are doctors. Should they not, at least ask the question, is there some correlation between the time this patient's been vaccinated and their symptoms they're experiencing? I mean, again, I'm not a physician, I'm not a scientist, but they are, and they certainly should be asking the question at least, and not being so dismissive of vaccine injuries.
Yeah, well, I think one thing that people have kind of learned is that research, studies, perspectives on medicine and health and vaccines, and just specifically, can be motivated by your personal views more than the information. And people will automatically dismiss something if it goes against their worldview, or accept something that helps reinforce their worldview. And I've pondered on this idea on vaccines specifically for a long time. I have two little ones. My daughter's actually turning 6 soon. My son's 7, and neither.
Oh, yours are like mine. I have a 10 and 11-year-old.
Oh yeah. So
Irish twins.
Oh yeah, yeah. Mine, yeah, they're close enough in age where I mean, my daughter's tall. They're both tall, but my daughter is like almost the height of my son. So sometimes people be like, "Are they twins? Or are they the same?" But it's neither of them have been vaccinated, and I've never, it's just one of those things. I truly believe in, like, eating right, exercise, taking your vitamins. Your body is the best medicine and your best defense against just about anything. And but I've always like kind of pondered on this idea: why do people get so emotional when talking about vaccines, and why is this such a hot topic? And it's one of those things where, like, at such a young age, it's almost like being told the sky is blue, or the earth is round, or whatever, whatever it is. Like, regardless if it's true or not, if people start conditioning you into believing certain dogmas when you're very young, it's very hard to go against those dogmas. So it's at such a young age, kids are born, every kid's getting vaccinated, you go to pediatrician, it's like this lovely place where everybody's smiling and giving stickers out, and everybody's in a really good mood, and there's kids everywhere, and there's adults that love kids, and it just, and it's like, we're giving you these harmless vaccines, they're going to protect you. Like, we, at such a young age, we get conditioned to believe that, like, vaccines have saved us from polio, have saved us from, like, all these diseases throughout history, and we give them to our little ones. And so it's like, it's one of those things where at such a young age, we're so conditioned to believe that vaccines are only good and never bad, that once, even though this isn't a traditional vaccine, I feel like only just because it's called a vaccine, or just because it's in a syringe, like, we still have this worldview that, like, okay, this is a good thing. This is going to help this disease, just like previous vaccines has helped with previous diseases. And it's so hard to shatter that. It's so hard to get people to see past that, because I think it shatters their worldview, like what they've been told their whole lives. It's like telling somebody, like, hey, the sky's purple, it's actually not blue. And people are like, what? It's like your first reaction is to resist. I've had conversations with people about vaccines, and just kind of like sparking the conversation, and we're politely talking. People get so emotional, and it boggles my mind, like 5 minutes into the or even less than that, 5 seconds in a conversation, that you realize, like, they've done zero research, they know nothing about this topic at all, but yet they have such a strong stance on it. And so it's like, even prior to 2020, like, I've been in plenty of discussions where I'm just like, you don't know anything about vaccine courts, you don't know how common adverse reactions are, you don't know if the polio cases and deaths were already drastically going down before even introducing the vaccine. Like, there's a lot of general stuff that you don't know, but yet you're so quick to look at me like I'm a crazy person. And
so if you don't mind me asking, was there something that in your personal life that made you look at vaccines that in that way prior to COVID?
So this goes back to, I guess, my intrigue with, like, health and nutrition and exercise. when I first got in that topic, I realized like, oh my God, like there's a lot of evidence that the DSM is complete, just nonsense. It's not scientific at all. Like they're just saying, oh, you have a chemical imbalance. I know plenty of people that were on antidepressants and anti-anxieties. They were told they had a chemical imbalance, and I would ask them like, have you ever been tested for the chemical to see which chemical is imbalanced, how imbalanced it is? I'm like, how do they even know what they're diagnosing or what they're dealing with? And they're like, no, they just told me to try this. If this doesn't work, I try that. And it's so you start planting the seed of doubt in the whole medical world. And then I start going down the rabbit hole of like people who have cured themselves of cancer naturally, people who have dealt with tons of health issues naturally. I've had Jim Abrams on the show, who is the filmmaker from Naked Gun and Airplane and all those hilarious. There's some of my favorite movies growing up. They're just like slapstick, hilarious movies. But he has a very intriguing story. And I know people have either listened to the episode or have heard me tell this story before, but I'll briefly talk about it. Where he had a son that was having these violent seizures. And he went to, at the time, this is like the height of his career. His son, Charlie, was having all these violent seizures. So he was going all the best hospitals, doctors, people who had huge waiting lists. He got to cut in line, and just because of the people he knew and all that stuff. And all the doctors were just basically suggesting more prescription drugs. So his son was on like a cocktail of things, even ended up having a surgery. Well, one day he's doing his own little research, and he runs into some John Hopkins research about putting your kid in ketosis, basically doing the keto diet, and having some success with dealing with these things, right? So he brings it up to his doctor, and his doctor's like, oh, that sounds too difficult. And he's like, more difficult than dealing with hundreds of seizures daily that are having probably long lasting negative effects on him. Like, no, that like this is something that somebody should have suggested to me or at least mentioned. And so he puts his child on his son Charlie on the ketogenic diet, cures him of all these seizures, and starts a foundation called the Charlie Foundation. And the reason why this story is important, and I tell it over and over again, is because we live in this illusion that if your doctor doesn't suggest it, or if your doctor's not telling you this information, then it must be pseudoscience. It must be crazy. And he's a person who got to go to all the best doctors, got to cut in line, all the best researchers, and not one doctor mentioned that the ketogenic diet could, that there's some research that could help. And
well, that's probably because it wasn't in one of those high impact journals that they are so fond of.
Well, what happened? Well, apparently John Hopkins, when they did the research, initially they were doing the ketogenic diet, and then they started introducing pharmaceuticals, and they're like, "Oh, we're gonna now start focusing our research and development on prescription drugs to help this issue instead of a dietary method." So but so many times you say something to somebody and they're like, well, if my doctor didn't bring it up, it must not exist or it must not work. Like it has to come from, quote unquote, an expert. And his story is important because he went to all the best experts and not one person suggested this. So, my point is like, you have to do your own research. So all these little things, I've been doing the keto diet for I don't know, 7 years or something like that. And I'm big into like just eating right and being, exercising and eating things you could pick, things you could grow, things you could kill, like our ancestors have ate forever. And so I guess to make a long story short, to answer your question finally, the reason why I got skeptical of vaccines is because that was the next transition. It's like, okay, I've come to the conclusion that I cannot trust big pharma. That I cannot trust mainstream science, that they also have dogmas, that they also have tribalistic tendencies that force feeds you certain information because it helps their worldview or it helps their bottom line or profit. And then you look at all the amount of prescription drugs that get FDA approved and taken off the market was just like mind boggling. I couldn't believe how many. It's like, wait, so it's FDA approved to be safe. So the whole point of having the FDA is so we're not guinea pigs for big pharma, but yet like there's tons of stuff that gets FDA approved and taken off the market within 12 months or sometimes less. And then the fact that like I was learning that pharma doesn't have to show any studies that show that their drug's unsafe, that they basically get to do their own studies, then just present whatever studies they want to the FDA. I'm like, the whole thing just seemed really unscientific. And then the more I would hear, I push against these narratives, people would be like, well, the science is settled. And I'm like, wow, that's the most unscientific thing you could say. Like, the science is never settled. Like, this is what we think right now. This is what we understand right now. But there's always evolving opinions and evolving studies and whatnot. And then the percentage of studies that can't be recreated is like, I forget what the number is, but it's like, it's really high. So you realize,
like the analysis from the study, you mean?
Yeah, well, so
in terms of recreation.
No, I guess there's been, and I forget what the percentage is and what the article was, but there's been, I know James Corbett in his documentary, The Crisis of Science. I highly recommend people checking it out. But he documents it in that documentary. It's called The Crisis of Science, and so basically you have a study. People come to a conclusion. This is the outcome of the study. Well, apparently, if other people try to recreate that study to get to the same outcome, they'll have a different outcome. Because, and as you know much better than I do, I mean, I'm kind of just, just stating things I've read and just my understanding of it. But any little slight variation of something can change a study drastically, or even somebody's interpretation of something, or the way, when you're crunching data, like there's so much wiggle room and little things that can change the, I'm a big Gary Taubes fan. He used to write a lot of articles about science and like just bad studies and all this stuff that gets peer reviewed that wasn't a good study. And he was a science writer. And then he got into the nutrition world and kind of made a name for himself against like exposing all the poor research about nutrition. But his story and his work is so important because literally he's made a living off just dissecting poor science that gets peer reviewed and poor science that gets published and poor science, and like how it's so easy to see the flaws in these studies, and yet it's stuff that gets regurgitated over and over again. I forget, he uses a really good example of like a study that like people kept just referring to over and over again. They're like, oh yeah, it was proven with this study, it was proven that, and like everybody kept referring, and then he went back and like found the study, and he's like, it was like one of the worst studies ever, and yet it's the one that everybody references when talking about whatever whatever they were talking about, whatever the topic that it highlighted. But it just, so I've always been really skeptical of that stuff. And it's like that saying, if you're not a liberal when you're young, you don't have a heart. If you're not a conservative when you're old, you don't have a brain. I was just a really passionate, like young, I didn't use labels, but I would definitely call myself more liberal than conservative in regards to where I was when I was young. So to me, it was like, I was very skeptical of all corporations. So I'm like, big pharma makes how much money? And like they get fined like crazy, and they're not out of business, like, and they lie. So it's like my skepticism of corporations in general just kind of led me down this path. And then when I would go to the gym and you meet these guys who are gym rats like I am, only they're 70.
I can't tell. Kidding.
and yet they're they're 70, and they talk about like just eating right and exercising and people who live very natural lifestyles. I'm just like, wow, this person's way healthier than the person who's taking 12 different prescription drugs and are putting all their faith into the medical world, and instead of being proactive and taking things in your own hands. So it's just, I mean, that's why I think when all this stuff happened, I was much more skeptical initially than the average person. I also understood the power of big pharma. Like there was every other commercial, and then you look at the pill epidemic. I live in Massachusetts. I live in New England. Like this was the heart of the pill epidemic. I had years where every couple months I was going to another funeral of somebody I grew up with, and I'm just like, how is this not talked about? How is the Sackler family not in prison? And then I don't know if you ever watched Dope Sick, but I would tell people, I'm like, watch Dope Sick. Look how easy it is to manipulate information. Look how easy it is to get FDA to get your product approved. Look how easy it is to deflect the dangers of your product. It's just the whole thing's a facade. So I mean,
yeah, it's been hard for me to to understand that. Not that it's hard to understand it. I wasn't paying attention before. I just wasn't. I had a job and did that, and then it's kind of like the chain of command, right? So I make sure that my data that's from my patients, and I'm assuming this is happening at all of the other sites where these patients are coming from. Pick your study, it doesn't matter. But I know my data, there's integrity behind it. And we followed regulations, we followed protocol, we did what we were supposed to do. Then the job that comes next would be for the regulator, the FDA, to do their job. So I wasn't paying attention.
So obviously you weren't paying attention, and it wasn't, I mean, and it's also the field of work you're in. I mean,
I just trusted. I trusted. That's what they're there for. That was their job. I'm doing mine. Now they're going to do theirs. And again, I'm not so naive that I don't think that there's corruption, certainly. But I just, and I find myself in this some days where I wish I could go back to like before I knew all this, because, you know, I was happy in that space. And now to know that I've just been lied to like so many other people, and it's just a tough spot to be in right now, especially with, you know, the court case and everything going on. I mean, it's strange.
Well, it's like that saying, ignorance is bliss, right?
Ricky, can we pause this for 1 second?
Yeah, no problem.
Thanks. 1 sec.
It's all right. My kids are over here sitting down on the couch because my wife just went to work. So she's.
Aww. Well, at least they're being well-mannered and behaved.
Yeah, well, it helped that I just told them, like, hey, after the podcast, I'll take you anywhere you want to forbid your little blackmail works. But yeah, so you, when you were seeing what you were seeing, did all these things start unraveling the way you initially perceived the whole system? And have you ever seen anything even similar to this? Because you've been a part of other research, like you've never seen anything this bad, or you've never really seen any real manipulation of data like this?
I have never seen any study conducted the way that this trial was, from both the site level and the sponsor level and the contract research organization level. All of it was unlike anything I'd ever seen before. And like you said, I've been involved in these high enrolling studies. You know, this is my area of expertise. I'm sorry, I'm gonna have to pause a minute, Ricky. I'm so sorry, my computer is about to die. It's like 100. Yeah, so when I started, you know, at Intavia, I was excited again to be there. I had ideas on how to make, you know, their operating procedures better. And what I was taking my findings to them on a daily basis from day one. We had a daily call every morning at 8 o'clock. All of the directors were on the phone discussing, you know, just a variety of things. And so I would talk about, you know, what I was finding in Pfizer's trial, bringing it to their attention, the staffing issue, the patient safety concerns, all the things that I've talked about for so long. And I was told to start putting things on a list. I was bringing so many things to their attention. They just couldn't manage to hear that and continue to enroll more patients in the study, because that was their goal. You know, for every patient they enrolled, they were paid for that. So that was really, you know, the goal, not to further science and, you know, do what we were supposed to be doing. It was all about money for them. And eventually, you know, when I realized that Pfizer was also involved in kind of ignoring the problems, I decided to take it to the FDA.
And so those were some of the problems. Did you see any adverse reactions or anybody You did?
Oh yeah, certainly. Yes. There was a lot of confusion at Ventavia too about what would be considered an adverse event, what would not be considered an adverse event. That I think was something in the protocol that Ventavia did not understand. And so yes, I certainly saw adverse events and then serious adverse events as well, that were not being captured, that were not being followed up on in a timely way. There's so much, Ricky. I'm shocked that Ventavia is actually still in business after what I've reported, after what I've found. They continue to be rewarded by Pfizer with different contracts. They've participated in other COVID-19 vaccine candidate trials. Pfizer is not the only one. And it just keeps going. It keeps going. They've slandered me. They've defamed me. They continue to do that. I feel like Pfizer is now doing that and calling me, anti-vaxxer. I just feel that's so defamatory, because I am not. That is one thing that, I listened to your story and I would never think of you in a negative way because that's how you feel about, yourself and your children. But I'm not an anti-vaxxer. Mine get and have had and are up to date on all of their childhood immunizations, as am I. We would typically get our flu shots every year. I've been vaccinated against COVID. My mind has changed, certainly. We will not be getting any more vaccinations. So my journey, because of all this that I've been dealing with Pfizer has changed my mind about so many things, but I don't like being called that. I think it's mean, and your definition of that's changed. And I don't like being called anti-government because I'm also not that either. I'm maybe right now I am, but historically I have not been anti-government. It's to me just slanderous. Ventavia actually had to be sent a letter by my attorney, a cease and desist letter, because they put out a public statement that although I'm trying to remember the exact quote, but it's going to be hard for me today, that while I was there for 18 days, none of my job responsibilities had anything to do with the clinical trial in question. So that's what their public statement was, which was a lie. But it's still circulating, the internet.
Yeah, it's hard to stop that stuff from circulating, and people would just read headlines, they don't look into stuff, and then it just repeated. The thing about the vaccine topic is that I'm also not anti anything. I'm pro information. My big problem with specifically that topic is that people hear one side of the story and the other side of the story gets completely suppressed. And my big thing is like, parents should have all the information, then they decide which risk reward they want to take. And maybe some parents think not vaccinating is a bigger risk than vaccinating, and that's completely okay too. But parents should know that some people do have reactions. Some, historically, thimerosal was in vaccines. Robert Kennedy Jr. was a big part of getting that removed from vaccines. But they used to say all the time that, oh yeah, that's not harmful. And then eventually they proved it was, and they removed it. So it's like people should just get all the information, be open-minded, and then as a parent or as an individual, you should decide what's best for you and your family. But the part that bothers me is that people don't hear the other side, and typically that side gets suppressed or dismissed as like an anti-vaxxer, and they say you're a crazy person. Yet we know for a fact like that you can't give the same cocktail of anything to everybody and think that somebody's not going to have a adverse reaction. I've always I use this example all the time. I'm like, peanut butter isn't necessarily harmful, but if I mandated peanut butter and jelly to every kid guess what? Some kids are going to die. Like some kids are going to have an adverse reaction. Like, so it's just one of those things where this idea of dismissing vaccines as like always being safe and effective for everybody, that alone cannot be true. Even the most harmless things can be dangerous to some people. So it's, you know, and again, like I said, information, but unfortunately,
Yeah.
we learned through 2020, you control the information, you control the narrative.
So true. So true.
And that's why censorship in big tech is something that constantly gets talked about during all this, because a lot of your story, a lot of other people, you know, Dr. Robert Malone, Dr. Jessica Rose, I mean, they were getting banned and censored everywhere. And Dr. Peter McCullough, who's also been on the show, you know, these guys are just physicians. They're people who are just giving you a different perspective. And this is why so many anti-government people were outspoken, because they're like, look, this is Big Brother deciding what truth is. This is big tech deciding what truth is for you, instead of saying, let me filter out the bad ideas. Give me all the ideas, and then I'll filter out what makes sense or doesn't make sense. Because if you do it, you're basically saying I'm not intelligent enough to do that, to decide. And then also, like we said, like it doesn't matter if you have a PhD, if you're a doctor, or if you're not. Like everybody has ideologies, everybody has perspectives, and that's always going to factor in to what they think is information that's good and information that's bad. And if they have the power to be like, you know what, I'm going to suppress the information I think is bad and then give you what I think, you know, is good, then, you know, like I said, they're basically molding, it's social engineering. They're molding our worldview on any individual story. So so you end up, obviously you attempted to go to the higher ups and kind of acknowledge that, hey, there's something going on here, you know, this isn't right. And obviously you got pushback. Were you working with anybody else that was also kind of seeing what you're seeing and getting a little bit fearful of just the studies and research, and if any of it was legit?
I mean, everyone at Ventavia, and we didn't have a lot of employees, and that was one of the problems. But the people that I interacted with on a daily basis were aware that we were understaffed, that we were placing people in positions that were beyond their scope. For example, the person that was vaccinating was just a receptionist. And I don't mean to say that in a negative way, but that was her job. She had no medical training at all. And her prior work history was at in retail and in restaurant work. So she had no business, you know, diluting vaccine and injecting this vaccine into, you know, over 1,000 people that ended up being enrolled into the study. So they were aware of the problems, certainly. And they actually, at one point, took my advice and stopped enrolling in the clinical trial long enough so that they could start to clean up what some of my findings were. And that was on the 16th or 17th of September of 2020. Paused the study, and they started bringing in friends and family members to go through these patient charts and fabricate and falsify data. There were some consent forms that did not have signatures that we were finding, and eventually, you know, when this pause and cleanup started to happen, they were forging patient signatures. So I tried to alert Pfizer to that as well, and was not able to reach them right away. But there were red flags. Pfizer knew what was going on. I have documentation of emails and correspondence where, you know, they should have known. They did know what was going on. So that's been hard for me too. You know, everybody knows what's going on, but nobody is saying anything. Nobody's doing anything. And I lose my job for coming forward. It took, it was June of 21 when the person that was responsible for actually terminating my position sent me a text message and apologized to me and asked me if there was any way that I would be able to forgive her for not standing up for me. And she told me that she'd actually been fired herself for the same things. So I know that, in other clinical trial sites, this was more than likely happening too. And that was one of my questions. If this is happening at Ventavia, where else is this happening? It has to be. And we're finding that out more and more now in patients coming forward that participated in clinical research. I know of a couple that have reached out to me directly that were participating at, again, other sites. So the story's starting to make sense and come together for me. And I do now understand through just the capture, the regulatory capture, the censorship. It's making sense to me. I'm understanding now.
So does this make you skeptical of all the other studies and research that was kind of justifying the vaccine's safety and how effective it was?
This particular vaccine or all?
Well, just because now, obviously seeing what you're saying, you must be skeptical of all the research that, is around these vaccines, the Moderna research, all the research that shows that it's effective. I mean, I don't know how they came up with the 99% effective number when they first, proposed that or marketed the vaccine. I'm like, how do you even come up with that? Like, supposedly we barely know anything about this virus, and yet you already know how the vaccine's going to work. It just I knew everything was kind of fast tracked, the research for it and whatnot, and it takes a long periods of time. I mean, that's the other thing too. Like, did the study seem like it was being fast forward a little bit, like they were trying to quicken it? Or because even vaccines studies, like you always hear, oh, it takes years and years for a vaccine to get approved. Like, the fact that they have no long-term studies, that alone had to be a little nerve-wracking, because I would tell people, like, there is no long-term studies. You are the long-term study, unfortunately. It's like, it doesn't mean that anything gonna happen, but it doesn't mean we know that something will or won't happen, or how common it is for something to happen. But so even like the Moderna studies, all this stuff, you've read other stories, people who have similar stories to yours about seeing, falsified documents or just cutting corners and all that type of stuff?
Well, I was talking more about like patients that have come forward that were participants in Pfizer's trial specifically. But my time at Ventavia was short. It was 18 days, right? But this wasn't the only clinical trial that they were participating in at the time. There were others that I was auditing and looking at, including those other vaccine candidates. So the data in Pfizer's trial looked the same in Moderna's trial and Novavax trial that they were participating in, and RSV clinical trials that they were participating in. So this was not just a Pfizer problem. This was a systemic problem within Ventavia. And so I've seen that. I haven't been able to do anything with that information yet, except give it to the government. They know. So I'm just in this kind of weird space right now, especially with the lawsuit that I have against Pfizer, Ventavia, and Icon, where I was just able to finally talk about it in February of this year. I filed the lawsuit in January of 21, and it took them a year to unseal it because they said they were investigating the allegations, but we'll never know what that investigation looked like because it's all under seal. That will remain sealed. But I do know that the FDA has never walked into Ventavia Research Group and looked at any of their studies.
That's wild.
Never happened. I know. It's wild. It blows my mind. I mean, I spoke to an inspector with the FDA for over an hour on the 29th of September of 2020, and I told her everything that was happening, listed out and went over my complaint in detail, and they never walked in the door. And I understand, I have an opinion about why that happened, but it shocks me.
Yeah, it's a if any good came out of the lockdowns in 2020 is I think it made people much more open-minded to a lot of these issues. I think it made people a lot more skeptical about the
I was going to say that. I would say open-minded and more appropriate skeptical. I mean, I am for sure.
Yeah, yeah, because I mean, science was just one of those things where it's like if you were questioning science, a lot of times you were either like scientism, you're about all, the religion of science, where just like everything's material and anything else is like supernatural or pseudoscience, or you're on the other side and you're questioning science. And it's like now I think a lot of people who maybe never entertain these discussions are now becoming much more skeptical about how good of a system we have in regards to health and medicine, the FDA, all that type of stuff. And I mean, the fact that people are even entertaining the idea of vaccinating their children at 5 or 6 or whatever, toddlers, for a disease that is or a virus that is less harmful to them than the common flu. It's like it's mind-boggling, but again, like I think that if any good came out of it, there's going to be a lot more people who are going to maybe when the time comes around to get the flu vaccine, or the time comes around to get whatever booster they're on now, like the 8th or whatever. I don't know.
I can't even.
It's what realistically, what is it? Are they on the 4th booster, 5th, something like that?
I don't know. I'm keeping track. I can look actually. So I've started this. It's like a little spreadsheet, and it's like the date and approval of everything new with this product. And I'm like on page 15.
Wow.
Yeah. I'll have to look for it. I can send it to you. This is my little cheat sheet, but yeah, the booster.
Well, a lot of people like Dr. Jessica Rose and yourself, like a lot of people who have made a living off on believing the experts and believing in science and believing in the whole process, that now are some of the most outspoken people, because they are heartbroken that they're putting people's lives in danger to promote something that could be harmful. And yeah, I mean, it just, unfortunately, the issue with everything is always money and power and corruption. And it's not to say that there's good people out there and there's not good research being done and not good science being done and there's not medicine that can help people. But people should still not put their faith and trust in everybody, in some higher hierarchy, some a doctor or a expert. People should really do their own research. And we live in a world today where it's 2022. If you know how to do the research, because before I would say
where do you go though? I think that's even now, imagine being a physician, and where do you go for information? What if you're like on the fence, right? And you're just not sure. Where do you go for the right information? What is right?
Well, I
mean, I have a hard time like looking at, are we on video or are we just audio?
We're doing both.
Both, okay. But there's like, I hate to say that there's two sides, but there almost kind of is, right? There's one side that of professionals, and these include physicians and clinicians, et cetera, scientists, who say the vaccine is safe, it's effective. And then you have this other group, and they're both brilliant minds. But then you have this other group of scientists and clinicians that are saying it's not safe, it's not effective. I don't understand such, there's such a huge gap there.
Yeah, well, I think that people should be able to get all the information, like I said, and kind of decide for themselves what makes the most sense. But an issue that you're bringing up that I think is super important is the fact that if we're having a coffee and we're having this discussion, and somebody overhears what we're saying and they're like, wow, maybe they're right. That sounds like it should be, I should look into that. If they go home and they Google it, we're going to sound like crazy people, because they're going to say all the things that they're bringing up. I can't find any evidence of this. Like they're insane. Like there's no evidence of this. All the experts are saying the opposite. And so you're right. I mean, that's why big tech and that censorship is so important. That's why I'm such a fan of BitChute and Odyssey and Rockfin and all the other platforms that are letting us have these discussions so people can hear both sides of the story and get all the information. Because the average person, they're going to use Google. The average person is going to go on YouTube, and they're just going to be force fed the mainstream narratives. So, before, when I remember when I first started podcasting, I did all my research via Google and YouTube. Like not all of it, but a lot of it. I would do
a lot of it, yeah.
It would start the rabbit hole, right? I would Google something, and then it'd lead me to this website or this researcher, and I go over there. But it would always start on Google. And now,
and what about the medical journals now? I mean, the New England Journal of Medicine, when I looked at that study, I read that study a long time ago. And then I started to look at the clinical trial sites that participated in Pfizer's vaccine trial. And the first author on one of the papers, the first and second author, are principal investigators that worked on this study. And I just think that's such a huge conflict of interest. And especially when you're stating that this vaccine is safe and it's effective. Well, I just think that that's a huge conflict of interest, and something, that we need to look at too, are those conflicts of interest, and not just big pharma, but our government too. I just don't think that you should be able to own anything that you kind of oversee.
Yeah, no, you're absolutely. The revolving door is everywhere. I mean, you see people who work for Monsanto now work for the government. I mean, you see it over and over again.
Well, even in law too, we've kind of found that recently. I won't get into that, but yeah, it's everywhere. It's everywhere.
So, what is the current state of things for you? Are you you're obviously going, there's some type of court case going on right now. Is there any updates on that, or what's also the best way of keeping up with you? I know you're on Twitter. Are you on any other social media platforms, or do you have a website or anything like that?
No, Twitter is the only social media platform that I use. I just find it's so hard to keep up with others. If I want to say something or post something, doing it in one spot's easiest for me. So it's just Twitter. But the court case is moving forward. All three defendants, Ventavia, Icon, and Pfizer, have a motion to dismiss. We are working on our kind of just argument against their defense. And it's very interesting what they're using in their defense, or in their motion to dismiss, and that's the contract that Pfizer negotiated with the Department of Defense for these vaccines and the purchase of those. And they didn't use your standard contract. They used what's called an other transactions authority, or an OTA, or prototype contract. And basically what that means is, for Pfizer, they did not have to follow any of the standard federal acquisition regulations that govern contracts. They didn't have to follow any of the standard codes of federal regulations that govern clinical research. All they had to do was bring an approved product or from the FDA. All they had to do was get the FDA to say, we'll give you an authorization. Those were the only terms of payment. I just find that fascinating. So that's kind of what we're having to argue, and it's very difficult to argue that a contract that they signed that says we didn't have to follow the rules, and they didn't. So that's kind of where we are right now. Our kind of defense to their motion to dismiss was going to be due August 6th, but I believe they've allowed us an extension just because we needed a little more time.
Yeah, well, I know you have quite a Twitter following, which is good because it shows that people care about the story. People
Yeah.
are obviously really appreciate your courage to come out and be outspoken. Obviously, it's not a great career move if you're planning on staying in the same field of work. So obviously, you did it because it's more important to do what's right than anything else. And you have to be able to look in the mirror. That's why it's during this whole thing, so many people had a hard time grasping this idea that they could willingly put out a product that they knew could potentially harm people. And I think people they a lot of people have a hard time grasping that type of evil exists, and that or that money and profit and could trump morals to that extent. But the truth is, unfortunately, uh typically this a reality is scarier than fiction, and there's
Yeah. Yeah. Wrap your head. Be the average person and wrap your head around that. I mean, people just cannot wrap their head around the fact that this is being promoted by the people that are supposed to protect us, and it's shown not to be safe. It's shown not to be effective over and over and over again. And I think that, and the way people source their information with, the internet and social media, it's hard.
Yeah, I mean, and all the things that people are ignoring. I mean, there's this giant increase. You hear insurance companies, life insurance companies, talking about this giant increase of deaths.
Yeah.
People at a young age between 20s and 30s, like just going up. You see all these athletes. I'm Portuguese, so I'm a big soccer fan, and all these athletes, soccer players that were passing out on the field. We would be
Yes.
watching,
Yes.
and over and over again. I'm like, I've been watching sports for a long time. I've never once recalled a athlete passing out playing soccer on the field. And
I mean, you watch Premier Soccer, I'm sure, right?
yeah, so I watched the English Premier, and
Okay, have you seen anybody do that?
yeah.
Like when you're watching it live, though, I've never seen it happen live. I loved Brian's video, one of them from, it's been a long time ago, but at the end, he's like playing his guitar, and I had no idea, so now I love him more, and his voice is amazing. But this kind of compilation of these players and just passing out on the field, I was shocked because you don't hear about that, right?
Well, the famous one was the Christian Eriksen during the
yes, I actually do remember seeing that. My son's a soccer player, so I kind of like, my ears have perked up.
Yeah, so were my kids, and so we were watching that game together. I was a big Christian Eriksen fan because he used to play for my English Premier team, Tottenham Hotspurs, and so he passed out. I remember watching that, but then there was all those conflicting just opinions and people saying, like, some people said he was vaccinated, some people said he wasn't, and I don't think it ever got confirmed. But
he did have like a prior history of cardiac issues.
Which, yeah, and this is where it gets a little tricky. Mm-hmm. It's like, okay, was it that, or was it vaccine related, or did the vaccine make it worse, or was he even vaccinated?
Well, that's what I'm saying. You have to be able to ask the question, and when these physicians are not able to ask questions, that's a problem. When it's immediately dismissed as unrelated.
Well, look at Sergio Aguero, who played for Manchester City, went to Barcelona, and he had to retire. The dude was like at the height of, not the height of his career. He's a little older for a soccer player, but he's still amazing performer. And to retire, I mean, I remember watching that press conference, like my heart dropped, and I couldn't believe, like, and there's also a guy who plays in the NBA, young guy. What team does he play with? I forget what team he plays for, but he had a adverse reaction, and they basically have like suppressed him from being able to talk about it. He's a gamer, and I think during one of his live streams, he talked about it, and then that went viral a little bit. But so you hear these stories. These are the best athletes in the world. They are, at the pinnacle of performance and health. Why would they need it? And it makes no sense. And when you start seeing, and the other thing too in the Premier League that I started seeing a lot was fans passing out. Like, so there was like I think 2 Tottenham games where they had to postpone it, or stop it, delay it because somebody was passed out in the stadium, and then the medical staff had to go there or whatever. And I'm just like, that's, and you in the UK, like, to go to these live events, you had to be vaccinated. So there's a very good chance it could be related. And again, like, how many coincidences do you need before it's not a coincidence, before you start connecting the dots? And
well, Ryan taught me that there are no coincidences. When I interviewed with him so long ago now, that I just don't believe in them anymore. Especially right now. Just but my question is, why? We've seen all this happen in the Premier League. Why haven't these people come forward?
Well, I don't think athletes do want to come forward. I mean, look at that guy Isaac Johnson, who from the Miami Heat, who was outspoken. That like video went viral, but eventually he gets like pigeonholed as like a crazy Christian person, and anti-vaxxer. Same thing with Kyrie Irving. I give Kyrie. I'm not a huge fan of Kyrie as a person, because I think he's sometimes it comes off a little arrogant. But I do give him a lot of credit for doing what he did and being like, you know what, this is bigger than basketball. I'm gonna put my foot down. I'm not gonna get vaccinated. And he took headfirst all the criticism that he knew was going to come with it. And I mean, I think so. I had the cool thing about having a podcast is people can listen to it anywhere. So I have fans from all over the place, and I had actually a listener hit me up, and they know I'm a big soccer fan. And I can't remember if it was Roma or Napoli that he had one of his good friends worked on the staff. They're like a medical staff or nutritional staff or whatever, and he said that most of them, the whole team is not vaccinated, and he's like, they won't publicly say it, but he's like, just about the whole team's not vaccinated, and that it's much more common than we know. When the Celtics went to Canada to play Toronto, like a bunch, I think Jaylen Brown and Tatum didn't go. And then they said that they didn't go because of some injury that they didn't have, because the next game they're playing. So I think a lot of it's like, it became such a political issue that people don't want. They're like, I just want to play my sport. I want to be left alone, and I don't want to get involved with the politics of all this. But you hear like little stuff, right? Like the tennis player, nobody talked about him being unvaccinated until he couldn't travel. Same thing with Chelsea's midfielder Conte, who he's French, and he couldn't travel to the U.S. to play some of the friendlies in the U.S. And so it's like, none of them will openly talk about it, but then you hear these, or you find these stories from time to time where it's like, okay, a team's traveling somewhere and a player can't go because he's not vaccinated. But prior to that story, that player wasn't, saying, hey, you can interview me, I'm going to talk about it. Like, I'm going to talk about why I didn't get vaccinated. I'm going to talk about my skepticism of it. So I think a lot of times they just try to avoid it. So I think there's a lot more skepticism out there than we're even aware of. And because a lot of times, until the stories are forced to go public, a lot of people just keep it to themselves. They don't want to, and how many people are like, no doctors or have fake vaccine cards, and it's like, you know what, I'm not gonna say I'm anti-COVID vaccine. I'm just gonna get this fake card, leave me alone, and I don't want to get involved. And I'm just, because I think most people they just wanted their life back. They just wanted to go out to eat with their wife or husband. They just wanted to bring their kids to school without having to wear masks. They just wanted things somewhat back to normal. Not that the old normal was great, like we had plenty of issues in the world prior to 2020, but the new normal definitely sucked much worse, So, I think a lot of people were just like, you know what, I will just go ahead to get do whatever I'm told to do, just so I can travel. I had a neighbor of mine who's like, who was like first in line to get vaccinated, because he's like, oh, I want to go back to Portugal, and I just want to travel. And I'm just like, are you sure? I'm like, what's the point of traveling if you get harmed by this thing and you're bedridden? It's like, isn't your health more important? I'd rather be isolated, stuck somewhere, not being able to travel, but at least being healthy, than being able to travel, but like having some health issue that could be related to the vaccine. So it's and you're starting to see more and more of these stories, hit the surface with people having adverse reactions or whatnot. But now, unfortunately, we're back to prior to 2020, where everybody's distracted again. Everybody's like, again, doing like what you were doing. Nothing wrong with that, but like a lot of people are just like, hey, I want to go to work, I want to go watch my sports, I want to go to the movies, I want to do whatever. I'm just distracted again. So now, instead of being like, hey, like, there should be some people responsible for the last couple of years. There's people who lost their businesses. There's people who needed AA, who couldn't get it. There's people who needed community they get from church or sports, and they didn't have that. All the psychological damage to the kids who had to wear masks, and maybe linguistic skills have been delayed because they couldn't see faces. Like, there's just all these negative effects of the regulations and everything that happened, and yet we're just moving on. And it's a shame, because it's like, people should be responsible. Like, I watched last night, I was watching the recent episode of The High Wire that comes out on Thursdays, and I was in bed, couldn't sleep, and I put it on, and he was showing video of Dr. Fauci and Dr. Birx and the president all saying that if you get vaccinated, you're not gonna get and I'm like,
so embarrassing. It is so embarrassing when I see that. Go ahead. I didn't mean to interrupt you.
That's it. No, I was just gonna say, yeah, it's embarrassing, and we should be furious because they were openly lying. But yet, I'm getting kicked off YouTube. You're being suppressed. Dr. Robert Malone, Dr. Peter McCullough, every doctor that has an opinion is being suppressed and being called, misinformation, information, or disinformation. Ryan is getting kicked off platforms. All these people are getting kicked off platforms. Del Bigtree is getting, his YouTube channel was pretty big before he got kicked off. And all these people are being suppressed and called pseudoscience, but yet there's open, like, obvious statements showing that they were lying and misrepresenting these vaccines, and yet nobody's responsible. Nobody, that's why hats off to Rand Paul, who had the balls to call him out. And it's like, Fauci should be in jail. Like, and he shouldn't be even in jail just for 2020. What about the AZT stuff? And people go back and watch the Dallas Buyers Club. That was influenced by Dr. Fauci and what his team was doing in regards to lying about how effective AZT was, which was killing people. And then they repurposed it, and then all the politicians who made this all political by, you look in New York, they demonized ivermectin and hydroxychloroquine. They banned doctors from prescribing those things. I mean, that should be between a patient and a doctor. Like, a politician should have no say in what the doctor gives to the patient. Like, the fact that they even got involved in that, and then all the respirators and all that stuff, like, just the overuse of it. I mean, they're just like, and yet nobody's in jail. Like, nobody's in trouble for that kind of stuff. It's mind-boggling, and it's frustrating. But I also understand that 2020 and 2021 was trauma to many people who didn't know what was going on, they never watched Event 201 and say, oh wow, apparently they planned all this. Like, they didn't watch Plandemic, which Dr. Judy Mikovits and Mickey Willis. Well, I've had Mickey on the show. I mean, the extent that they went to suppress that documentary was just crazy. And it's like, if it's that crazy of a opinion, and if it's that crazy of a theory, what he was presenting in that documentary, then let us watch it and come to the conclusion that it's crazy. Like, they don't suppress it, and to me, it's like, the more somebody tells you shouldn't watch something, the more I want to watch it. I'm like, who is this, dangerous thinker, or what is this dangerous opinion? Like, I want to know why I shouldn't be watching this. And it becomes the forbidden fruit, where it's like, like, oh, okay, there's something sexy about it because they're telling me I shouldn't watch it, so now I want to watch it. But the extent they were going to suppressing people, which is crazy. But so people were traumatized. They couldn't. I mean, I remember driving by parks, and I'm just like, I don't know if I'll ever see kids playing here again. I mean, there was no basketball hoops anywhere. There was no like, there was just, I'm just like, it was so weird. Like every time I went to the gym, it was supposed to be a place to relieve stress. And then first they took away the gyms. And then when we had them back, it was a place full of stress because people are arguing about stuff. People felt awkward. You didn't know if you could get near somebody, if you could touch them. You didn't know if they were okay if you put your mask down or if they wanted you to wear it up or whatever. Like there's all this tension. And it's like, oh, finally it's behind us. Ricky, don't make me think about it again. I know there's people who should be in jail. I know there's people who should be in trouble, but please don't make me think about it again. Like I just want to move on. It's like any trauma. Like it's ingrained in your subconscious, and most of us want to kind of just move on with our lives and not think about it, and that's how we deal with it. And I think there's a lot of people who are dealing with it like that, like a traumatizing life experience where it's just like, I just want to move on from it. I don't even want to think about it. But the problem with that, it makes it easy for the ones who should be blamed for that trauma to actually,
be held accountable.
Yeah, absolutely.
Yeah. Well, I guess, that's kind of where I'm at, making sure that no matter what, somebody's held accountable for this. And maybe it's, not in the way that I think that it should happen, but I know that Ventavia will never forget my name, and maybe they will learn from this and conduct studies in the right way if they're allowed to continue to, conduct research and enroll patients. So yeah, I just have to be hopeful and give a little bit of grace where I feel like people are afraid to come forward. It wasn't a hard decision for me. I certainly had to think about it for a second, when I came forward and discuss it with my husband, because I felt that my job was in danger when I did that. I just didn't know that it was going to come directly from, my call to the FDA over to Pfizer and then down to my employer who, fired me. I didn't know it was going to happen that way. But, my husband and I had to talk about changes. If I lost my salary, what did that look like? We had to talk about it, but it was a quick conversation that took, just overnight really. And the next day, I knew that I knew it was so important that I had to come forward. And I think that more people eventually will, as more and more, unfortunately, injuries happen. And, there's almost like, that's why I asked you earlier, was there something that happened in your life personally that made you kind of seek the information to make your own decision, and a vaccine injury or a medication injury, or, I think that's something that for a lot of people, it's going to take that personal experience to kind of get them out of this, I don't know what the word is, like firm way of thinking that everybody that's not going and saying vaccines are great are crazy. So I hope that happens sooner rather than later, because this is just, it's time.
Well, I think your courage gives other people courage.
But it really wasn't. I thank you so much for saying that. I hear that so frequently, and I'm so appreciative of that, and the thoughts, and people just reaching out to me, thanking me. But I don't think that I was doing anything courageous. I was doing my freaking job. And I think more people need to do it,
Well, it's funny you say that, because a lot of people who do good things, that's the way they look at it. They're like, it was easier for me to do that good thing than it is for me to deal with knowing I could have and didn't, and so that's like a lot, but what you did, it was courageous, because especially at the time that you did it, it was not a very popular opinion to go against any of the science or research or any of that stuff, or even question anything. And you probably knew that there was going to be some backlash that probably came with it. But looking in the mirror and having a good moral compass, I'm sure, was much more important.
Yeah, I guess.
Give yourself some credit.
I'm working on that. I'm working on it.
So people should definitely follow you on Twitter. Definitely go back, and I know the Rebunked interview is a little bit more recent than the other ones. But,
yes.
I know you did 2 T-Lab Last American Vagabond interviews. Highly recommend people going back and checking those out and just hearing more of your story. And hopefully I have you on one of the Union of the Unwanted episodes. We do every other Monday. at 7 p.m. Eastern time. We live stream in Rockfin. It's like a big Zoom conference call of thinkers. Peter McCullough's been on there. Ryan's been on a bunch. Scott's been on a bunch. We've had G. Edward Griffin on, Roger Stone, Greg Pallas, Dr. Judy Mikovich. It's been awesome. But it's just like a bunch of researchers and thinkers. Dr. Jessica Rose is a regular on there too from time to time. And
which one is that?
So that's a show that I host with Sam Tripoli from Tinfoil Hat, Midnight Mike from the OBDM show, and Charlie Robinson from the Macroaggressions podcast. And it's a show that we actually started in 2020 because what we were trying to do was gather a bunch of content creators that were being censored, trying to get the information out there, and kind of brainstorm like, what do we do? Like, how do we help each other? How do we come together to fight back against what was going on? And so we started.
I love that concept.
Yeah,
what a great concept. Yeah.
So, and then we all came together, and then we're like, wow, this is fun. And then I'm like, well, you know what? How about we continue doing it? So we kept doing it. And then eventually they're like, you know what, let's make it its own show. So we called it Mike actually came up with the name because at the time we're all being censored and suppressed. So he's like, yeah, we're kind of like the Union of the Unwanted. And I'm like, that's a great name. So we end up calling it the Union of the Unwanted. So it's a awesome show every other Monday. And it's always like just a big group of thinkers and researchers and I just basically just throw the invite out to a bunch of people and see who shows up. So a lot of times I don't even know who's going to show up.
Right. And this is the one that you asked me to the other day.
Oh, that's right. Yeah. I asked you.
Yeah, man, I wish I could have. It's been we were on this deadline for kind of our response to their motions to dismiss, and I've been so distracted, and I'm very distracted today. So if you want to redo this podcast, I'm totally down with that, because it's kind of just, my kids are here. And like I said, I found some really exciting, well, it's not exciting, it's just more of the same. But I think, from the very beginning, the first authorization that was given in December of 2020, I've found some stuff, and I've just literally, my phone is blowing up, and I'm very distracted today, so I apologize. But I'd love to. I think collaborating. That's one of the. Hi, you're gorgeous.
Carl, come here.
Look how pretty you are.
That's my daughter.
Are you taller than your brother?
Oh,
hey, dude, what's up?
And there. Oh, it's somebody knocking on the door.
No,
It's Amazon.
It's probably Amazon. It probably is.
That's funny. You know what? My son plays soccer.
Yeah. Do you know her son plays soccer too? We were talking about it.
Mm-hmm. He's a goalkeeper.
They're asking what his name is.
Oh, his name is Braden.
Braden.
Yes, Braden, and he plays for FC Dallas.
Oh, nice. So he plays for a club, a local club. Yeah.
Oh, yeah.
We have a local club called Western Mass Pioneers, and he's been in the academy, and it's awesome. It's a lot. And you, that's right. And everything.
They're so cute. I don't know where mine are. They were yelling. I had to get up a minute ago and put them in line.
What?
Are y'all ready for the weekend?
Are you ready for the weekend?
Yeah.
Are you
Cool.
ready? You ready for me to finish this podcast? Because you guys have patiently been waiting.
Yes.
I'm actually quite surprised. You were talking about being distracted. I'm like, I'm surprised that my kids haven't been already in the screen and pulling at me and tugging at me.
Well, my phone, literally, I think I looked down a second ago, and I have 200 text messages. So what I found is really big, and I'm so sorry to be distracted.
No, it's all right.
But if you want to redo this and start over,
no. That's a part of. I always say, I'm like, I'm envious of people who can do a podcast and always sound the same, because I'm like, we have lives, we have things that, like, sometimes I get less sleep, sometimes I get more sleep, sometimes the kids are distracting me, sometimes they're not. Like, we all have.
Sure.
So it's like,
well, today was very distracting for me. But I would love to. Next time you do it'd be next Monday then, right?
We did one this Monday, which is so the next one would be the 8th. So I'll send you an email just to remind you, and that mark it down in your calendar, and then if you could show up there. I know Ryan, I think is showing up to that one too from T Labs. Maybe I'll throw Scott an invite and Dr. Jessica Rose and get a bunch of your friends. There'll be a Brook,
No, don't do that. Let me just check my calendar real quick.
But and I'll put links to your Twitter in the show description. If there's anything else that article or anything else that you want me to put in the show description, send it to me, any links, and I'll put it there, and we'll definitely talk again. Yeah, we could do more of these. Maybe I'll have Dr. Rose. I call her Dr. Rose, and I'm so casual. I'm like, you earned your PhD. I'm calling you Doctor.
I know, that's how I feel. Like, when I talk to her or to Dr. Corey, I cannot call them by their first names. It's awkward.
Yeah, well, I'm like, I don't want to dismiss the fact that you've earned.
Sure, yeah, they deserved it. They earned it. So I'm right there with you. But the 8th, actually, my husband's out of town, but it looks good. It's good because there's nothing other than that on my calendar. So I'll go ahead and put that down. I'd love to. I love the idea of collaborating. I'm working with Jessica on a few other things we're looking at. I'll tell you what we're looking at. Just in I guess 4 different areas, from clinical science perspective, from an ethical perspective, from a legal perspective. So that's 3. There's one more. I can't remember what topic that is, but what's the most compelling evidence in terms of where we've gone wrong and our findings. So it's going to be cool, I think, once we finally do it. But everybody's busy. Everybody's running thin on time and all that. But I think working together, we're gonna get through this.
Oh, absolutely. That's one thing I love about the Union of the Unwanted. So many people collaborate
Very
with
cool.
the show. They meet other people in the community. They end up hooking up and doing projects together. So it's an awesome tool to kind of just, and I strength in numbers. I believe in, helping each other out, and we're all kind of fighting for the same things. So why not? And you make some friends, because like I said in the beginning of the show,
Totally. Yes.
definitely lost some. So it's nice to make some new ones that you like. But thank you so much for your time.
Well, no, thank you.
And I really appreciate it. We'll definitely talk again. Maybe in the future, we'll do a collaboration with Dr. Rose, and Jessica loves coming on the show.
Well, I stood her up one time, so I don't know if I'll ever be forgiven. I was in a tough spot, and really, there've been 2 times that I've stopped working on what I'm working on, and every time I've been brought back by somebody who's been injured by this vaccine. And she caught me. We had a project we were working on, and she caught me right in one of those moments where I was just fed up and done, and I didn't join the call. But I'm back, and I promised the last vaccine injured person that I met face to face and was able to give her a hug and meet her, see her face, hear her voice, that I'd never give up again. So I'm just in this fight till the end.
Absolutely. Listen, it can be overwhelming for all of us. I mean, there's sometimes that I'm just like, I want to talk about something else, but it's because it's like, and then it's almost like they win if we just move on and we don't continue to, expose what really happened and what's really going on. So it's it's just one of those things where, like you said, we'll just keep fighting until who knows how this story ends, but we'll keep fighting until it does. But hey, enjoy the rest of your Friday.
Yes, go play with your kids.
Thank you. Don't appreciate that, and enjoy the rest of your weekend. If I don't talk to you again, and I'll definitely reconnect with you soon, and just kind of throw you a little reminder about the 8th. And
I appreciated that today. By the way, today was just, I'm telling you, it's been crazy. So when you go back and edit, Ricky, if you want to do this again, I'm totally fine with it.
No. Listen, people, it's amazing because people actually, believe it or not, people enjoy these casual type of conversations where it's like, it's not, it doesn't, sometimes the fact-driven, research-driven show, we're just like information, like doesn't get as much positive feedback as the casual conversation, because it shows the human side of people. It's like I try to capture a conversation we would have if we're out having a drink together, and we're just like, okay, hanging out, we're talking. Next thing you know, it's like, oh, 2 hours later, wow, that flew by. It's like that's the type of conversation.
Like now.
Yeah, exactly. Like now. I think the interview thing, we're just like, okay, I'm just asking questions. I'm not gonna go into any of my thoughts or opinions. I'm not gonna, I want to try to stay away from any personal stories. And it's like, there's a lot of interesting things about our thoughts and ideas and opinions and our stories that I think people get something out of. And sometimes we don't realize that, like, okay, maybe I might not think this story is fascinating, but you share a personal story or perspective, somebody's connecting with it, and somebody's going to enjoy it, and somebody's going to appreciate it. So some of my most I guess shows that have gotten the most positive feedback have been casual conversations, many of them with Dr. Jessica Rose, to be honest.
Yeah, I was gonna say she's great. She's good.
So
Well, all right, dude, I'll let you go.
thanks. Hey, enjoy the
All right.
weekend, and we'll keep in touch. Take care.
Sounds good.